Hi, my name is Molly, and I will be doing a focus assessment on my patient Joe. So we will go ahead and get started, and I will start by looking at his demographics, noting that he is a 34-year-old Caucasian male. I will go ahead and do hand hygiene and introduce myself as your nurse practitioner who will be seeing you today, and I will ask why he came into the clinic today.
For frequent nosebleeds.
Okay. When did they start?
About 2-3 weeks ago.
2 or 3 weeks ago, you started having nosebleeds. How frequently have you been getting them?
Usually once a day, every other day.
Okay. How long are they lasting when you have these nosebleeds?
A couple hours, hour and a half, something like that.
Okay. Are you bleeding anywhere else other than your nose?
No, just my nose.
Okay. Is there any pain associated with the bleeding?
A little bit.
What would you rate that at on a 0 to 10 scale?
Probably a 3.
Can you describe the bleeding, or can you describe the pain?
Yeah, just a little dull kind of ache.
And where is that?
Inside the nose.
Can you point to it?
Yeah, like up in here.
Okay. Is it radiating anywhere else?
Yeah, my sinuses are a little tender too.
Okay. Okay. Is there anything that makes the bleeding or the pain better?
Yeah, if I usually clench and kind of lean down, it stops going as much.
Okay. Is there anything that makes it worse?
If I disrupt it somehow, yeah.
Okay. How might you disrupt it?
Just blowing my nose or a Kleenex or something.
Okay. Okay. Very good. Have you been having, let's see, any cough?
No cough with it.
Okay. Have you been having any other nasal drainage?
Well, I've been a little warm lately, so yeah, I mean a little bit from that.
Okay. Let's see. What color is that drainage? Is it purulent?
Yeah,
Okay.
probably.
So not clear?
No.
Okay. So you're not having a cough. Let's see. Have you been having any fevers?
Yeah, like I said, just was feeling warm and had a fever a couple days ago.
Okay. Let's see. Any short of breathness?
No, I'm fine with that.
Okay. Any rashes?
No rashes.
Okay. Have you been had any recent exposure to any infections?
Not that I'm aware of.
Okay. Let's see. What about, do you have any history of allergies? Let's start with medication. Any medication allergies?
No medications, allergies that I know
Okay. What about seasonal allergies?
of. Sometimes, in the fall or winter, I get some sneezes and whatnot, but nothing too bad.
Okay. What about food allergies?
Yeah, I have a dairy allergy.
Dairy allergy. Okay. Do you have any pets at home?
No.
No. Okay. What do you do for a living?
I just work at a corporation,
Okay.
so indoors.
Okay. Very good. Are you taking any medications right now?
No. I do have an over-the-counter nasal spray.
Okay. Do you know what that's called?
I don't.
Okay. But you got it over the counter?
Yeah.
How long have you been taking that for?
Oh, 2 or 3 weeks.
Have you been taking that since the nosebleed started?
Yeah.
Okay. Okay. So you're not on any anticoagulants?
No, I have just been taking some aspirin lately for my fever and whatnot. but
Okay.
Nothing anticoagulant that I know of.
But you haven't taken aspirin long term?
No.
Okay.
No.
What about any other NSAIDs?
Nothing.
Okay. And your nasal sprays have all been over the counter.
Yeah.
What about your medical history? Any vascular disease?
No.
Any liver disease?
No.
Any bleeding disorders?
Nope.
Frequent sinus infection history?
Not frequent. I mean, sinus infections kind of just normally.
Okay.
So no.
Any other major medical history? Respiratory, circulatory,
No.
cardiac?
Nothing that I've had.
Okay. Okay. Very good. What about any drug abuse history?
No.
Any recent cocaine use?
No.
Okay. What about, let's see, any recent trauma to your nose? Or
No.
your face?
No.
Any nose picking?
No.
Okay. Are your immunizations up to date?
Yes.
Okay. What about your surgical history? What surgeries have you had in the past?
Just my wisdom teeth out.
No other surgeries other
No.
than that? Do you still have your tonsils?
I do.
Okay. Okay. What about family history? Any major medical history with your mom?
Nothing big on her side. Maybe a little overweight now, but she's generally pretty healthy. dad has diabetes.
Okay.
That's about it.
Any siblings?
Yeah, one sister.
Any medical problems with her?
No.
Okay. Okay. And we already discussed her allergies. Let's see. What about, do you smoke?
No.
Any drinking?
Once or twice a month, maybe.
Okay. What about exercise?
I do play in some sports leagues, like soccer and football and stuff like that, so I get out and run around for that.
Okay. Very good. Let's see. What about any history of abuse?
No.
Either yourself or...
No.
Okay. Okay. What about diet?
Eat at home a lot, so yeah, fruits, vegetables, meats, yeah, normal stuff.
Okay. Okay, very good. Well, the nurse got your vital signs before I came in here, and it looks like you do have a little low-grade fever today
Okay.
of 100.6. Your blood pressure is good at 112/68. Your pulse was 66. Respiratory were 14, and your pulse ox was 99 to 100. So that looks good. You are dealing with a little bit of a fever. So we can, as far as differential diagnosis is, we can go ahead and list the three of them here. The first, I would say, is mucosal dryness, irritation, or some sort of a mucosal sinus infection. The second one would be either vascular or hematologic disorders, or the third one would be trauma to the nose. But we can go ahead and rule the trauma and vascular and hematological or disorders out, just based on his personal medical history, as well as the trauma, since he has not noted anything recently that has happened. So now we'll move on to his physical assessment here, and I will start by looking at his nose here. So I will start by assessing the outer portion of his nose, noting the symmetry of his nose. I don't see any deviated septum. The dorsum and the tip all looks in line, intact, no lesions, masses, any noticeable swelling. I'll go ahead and take a feel. Do you mind removing your glasses for me here? And I will go ahead and palpate. Seeing if there's any tenderness. Is there any tenderness here?
Yeah, there's a little tenderness there.
A little bit. Okay. What about when I palpate your sinuses?
Yeah.
Both your frontal and your maxillary sinuses. Is it both sides? Pretty good. Okay. Very good. Well, I'm gonna go ahead and take a peek inside your nose as well.
Okay.
Let's see. So I'll hold this like a pencil here. Put my nose here. Very good, and I'll take a look at the other side here. All right, very good. So inside his nose, I don't see any polyps. I do see a little bit of purulent drainage. The inside of his nasal mucosa was beefy and red, which can be indicative of an infection. And there was also a little bit of red crusting, which we can tell where it has been bleeding. Other than that, I believe that was what I saw on the inside of his nose. And we can go ahead. I'm going to take a look at his ears as well right now, and take a look inside his throat to see if there's any other components that we might need to see as well here. So. All right, and I got my little tongue compressor here. So if you go ahead and open up your mouth for me. Very good. So the first thing I'm noting is that his mucosa looks nice and pink and moist. I don't see any lesions, any red marks, any white spots on his any of his buccal mucosa. I can note his frenulums here, both the upper and the lower. Can you lift up your tongue for me? Very good. All those are intact, and I don't see any problems with those. I'm going to look up at his salivary glands here up in the corner. Those look nice and they don't look clogged. I'm going to take a look at his soft and hard palates here. So if you could just lift up your tongue for me. Very good. And I'm also going to check his teeth, see if there's any tenderness to any of his teeth as I go around to see if there might be any dental problems there. Is there any tenderness when I tap each tooth? Very good. So I'm going to have you open up your tongue and just say ah for me. I'm going to take a look at your tonsils. Very good. So I see a midline uvula. I don't see any redness, swelling of his tonsils. They look nice and they don't look swollen at all to me. I probably they're about 2+ in the middle there. Let's see. Like I said, there's no red spots, no white film, anything like that that could be indicative of strep or mono. I think his throat assessment looks good. I'm trying to think. Yeah, his throat looks nice. And no cause for concern or infection there. I'm going to take a peek inside his ears. And so we're going to pull up and back and kind of hold this like a pencil. Very good. So I'm also going to start, before I would even look, just by assessing the outer portion of his ears, noticing that they are both nice and midline. The auricle on top is nice and midline on both sides. Is there any tenderness to palpation here?
No, that's fine.
Very good. And I don't notice any drainage, any masses, lesions, any discoloration. The color is appropriate for ethnicity. He does have, let's see. I don't see any obvious drainage anywhere as far as no earwax noted on the outside. His right ear looked very nice. I could see the nice pearly white TM. And I'll look on this other side as well. Very good. So again, his left side is, his TM is nice pearly white. There's no redness, bulging. Doesn't look like there's any fluid behind either of his eardrums. Let's see, it's just minor earwax, minor serum there, but no causes for concern there. So I will go ahead and take a listen to his heart and lungs. So I will start by listening to his heart here. I'm just going to start out by just observing the outside of his chest and noticing that I don't see any barrel chest. Look, there's a nice 2-to-1 ratio, nice and symmetrical. Just palpate a little bit, kind of along his ribs here. Any tenderness, soreness here? Okay, very good. So we're going to first listen to his aortic, and then the pulmonic, and then the Erb's point, and then the tricuspid, and the mitral valves. And we'll do that again with we're going to do that with both the diaphragm and the bell of the stethoscope. All underneath his shirt, but we're just going to leave that down right now for his privacy. I did not hear any murmurs. Are you having any palpitations recently? No. Didn't hear any murmurs. I heard a nice clear S1, S2 all the way throughout. It was all audible. No bruits noted. I thought it's a nice, strong pulse rate, probably right around between 66 and 70, just like his vitals were right when he came in here. So I would say that his heart sounds nice and clear. Nice rhythm. I'm also going to take a listen to his lungs. First by just noting his respirations. I'm going to watch him for a full minute and note that they're about 14 to 15 respirations per minute. again, looking at his outer chest here, as I mentioned before, there's no barrel chest. No, he's not short of breath. No, he's not wheezing. Let's see. So I might go ahead and just place my stethoscope, ask him to take some deep breaths for me, and listen to his lung lobes. So we listen there, listen there, and there. Listen back here, and back here. And for time's sake, I'm just placing where it should go here. So we'll go to the posterior thorax and do the same thing. So as he's breathing, I'm going to be listening for any wheezes, any crackles, either inspiratory or expiratory. I don't hear any adventitious breath sounds. His lungs all sound nice and clear. They're not diminished whatsoever. It looks, his lung assessment is nice and clear. I don't see any causes for any respiratory concerns at this time. And just thinking, going back to his nose assessment real quick, I'm going to also check the patency of his nostrils. So if you could just go ahead and close one side and breathe out for one, and then breathe in. Very good, and do that with the other side. Very good. So there doesn't see any, I don't note any clogged or nostrils. Yeah, both of his nares are nice and clear, so there are no problems with patency. So just wanted to get that in there as well. We're also going to check lymph nodes, just because he is complaining of some sinus. So we'll see if there's any tenderness, swelling within any of his lymph nodes that might be cause for concern. So we're going to start out with his preauricular. I don't know if you can see that. So we're going to go ahead and palpate that. And then we're going to go to his postauricular. And you tell me, Joe, if there's any swelling,
Sure.
Any tenderness or swelling.
Okay.
And then we're going to go to your tonsillary and your submandibular and your submental and your occipital back here. And we're going to do your your posterior cervical nodes and your supracervical nodes. And then if you could turn your head one way, we're going to do the deep cervical chain, which is easier to feel back here if you turn your head and go the other way. And then we will do your infraclavicular and your supraclavicular. So go ahead and kind of shrug down a little bit for me. I don't see any swollen nodes, any swollen lymph nodes on any of those that we assessed there. And there was no tenderness, is that correct?
No tenderness.
Okay, very good. Well, again, as far as the differential diagnosis is, we discussed, first of all, I believe, we can kind of pinpoint he's got some sort of sinus infection or sinus irritation due to the red beefiness of the inside of his nostrils, the red crusty, and the purulent drainage. The other two differential diagnoses that we discussed were some sort of hepatic involvement or vascular disorder. Due to his family history, I don't think he has any of that, as well as maybe a third differential diagnosis is a possible trauma because of these kind of frequent recurrent nosebleeds, and we can kind of rule that out as well since he doesn't think that he has had any of that. So just wanted to go ahead and go over some of that. I don't think we would recommend him to an ENT at this time. We'll just go ahead and figure out a plan of care for him and handle that here. So thank you for coming into the office today, Joe.
Thank you.